All right, everyone, welcome to Ethics Week. My name is Brian Levy. For those of you who don't know, I work with a team of folks here on Ethics Week, and principal among them for today is my colleague, Brett Beasley. His day job is being the Associate Director of the Notre Dame Deloitte Center for Ethical Leadership, but today he is our Zoom expert. Brett, what do the folks need to know about our Zoom webinar format?
Thanks, Brian. So I think that the main thing to know is at any point in the conversation today that you'd like to ask a question, go ahead and put that in the Q&A tool that you should see that down at the bottom of your screen. I'd also like to let you know that we are recording, and we've recorded all the Ethics Week presentations. So if you want to go back and view any of those, you can do that on the Ethics Week website. And I'll turn it back over to Brian.
All right, thanks, Brett. Welcome to the 24th annual Ethics Week. I'd like to thank our sponsors, the Mendoza College of Business, the Notre Dame Deloitte Center for Ethical Leadership, and Chase Bank. Our Ethics Week committee or team starts meeting the summer before Ethics Week, and if you roll back the calendar to last summer, you'll recall, it was a time of racial strife in the death of George Floyd and sadly so many others. It was a contentious presidential election. We were all witnessing the disparate impact of COVID on various communities, and that gets us to today's panel and panelists. But before we introduce them, I want to introduce another member of our Ethics Week team here. He is Ken Milani, and really for longtime members of the Notre Dame community, Mendoza community, needs no introduction. But his beloved Cubs, I think, are probably reporting the spring training as we speak. Yeah. So I've tried to wear my Cubs blue here for you, Ken. And so I hope folks will forgive a baseball cliche or metaphor in light of that. Ken is a five-tool player. He teaches here in the college. He researches and publishes. He is a founder of the Notre Dame St. Mary's Tax Assistance Program. He publishes a column for the South Bend Tribune on tax advice. And importantly for us, he's the founder of Ethics Week. When do you sleep, Ken? So with that, I'll turn it over to Ken Milani to introduce our panelists and their topics.
Hey, thanks, Brian. Today's topic is medical professionals discuss empathy in healthcare, its possibilities and its pitfalls. We've got three panelists. I'm going to introduce them and then have them speak up, and then we'll start the discussion. So the first one is Lisa Gorski, a nurse specialist at the Wheaton Franciscan Home Health and Hospice Center in Milwaukee. Tell us a little bit more on your background there, Lisa, okay?
Okay, thanks, Ken, and thanks for inviting me to participate in this panel discussion today. I work as a clinical nurse specialist. Technically, I work for Ascension at Home. Our name changed. So it's a large conglomeration of agencies in a number of states across the country. And I work as primarily an educator and in quality and do some degree of patient care as well. I'm also the leader of a big kind of guideline piece, a very clinical guideline. I'm very involved in clinical practice. So I lead this guideline as part of my work outside of work. I have almost my own business in terms of consulting, and I'm able to do a lot of travel and education, not only in the United States, but across the world. I visited many countries, and I have quite a few presentations coming up for that. So I'm very involved in a lot of different things. I feel like I've had just an amazing career. So I'm very happy to participate in this panel today.
Thanks, Lisa. Our next panelist is Phil Newbold. He's the CEO Emeritus at Beacon Health System in South Bend. So Phil, you want to fill us in a little bit more on your background?
Thanks, Ken, and great to be with all of you. I recently stepped down as the CEO of Beacon Health System, Memorial Hospital and Health System right here in South Bend, Indiana. I've been in healthcare for about 48 years now. Very, very active in a lot of community agencies and boards in education, health and human services, and that sort of thing. I stay active in healthcare. I'm on the LabCorp National Advisory Board. I'm president locally of the Medical Education Foundation, which works with the IU School of Medicine here in South Bend, and also chair of the Center for the Homeless Board. And so it's great that we have a chance to step away from busy lives and busy activities and really be thoughtful about ethics and Ethic Week. So glad to be here. Thanks, Ken.
Our third panelist is Brian Ratigan. I got to be totally upfront. He is my orthopedic surgeon. He hits me with some happy juice about every 3 or 4 months in my knee. He's also the head of the orthopedic sports medicine for Notre Dame football. So Brian, fill us in a little bit more. Don't talk about your time with the Colts though, okay?
I will not. Ken, thanks. Hey, thanks for having me. Yeah, no, I'm an orthopedic surgeon, sports medicine trained. I went to Notre Dame and did all my training outside. Been back here now for about 13 years and as a director of orthopedic care at Notre Dame. And obviously we're in a private practice group here with South Bend Orthopedics. And we work at all the hospitals with Trinity and Beacon and Unity. And we have a surgery center as well. So we stay involved with everything. And our group is about 23 guys now.
Okay, thanks, Brian. Now you can look at this 3-panel group and they don't know I've given them the name. We've got Beauty and the Beast. Okay, so I think that'll get us off to a good start. So let's start off with a question here. The mixed reaction to the COVID vaccine for healthcare personnel and the general population. There are people who are ready, willing, and able to roll up their sleeves and they say, you know, hit me with your best shot. One of my grandkids said, Grandpa, that's pretty old. Nobody's gonna know who Linda Ronstadt is. So instead, I'm gonna use the line from the Hamilton play, I'm not giving away my shot. Other people are so inclined, they have an anti-vaccine mindset, or they have a feeling that their personal freedom is being compromised or violated by mandating vaccine injections. So let's start with Lisa. You wanna give us your reaction to that, Lisa?
Sure. I'm going to speak first, I guess, to the nursing population out there. As nurses, we have really dealt with the COVID pandemic throughout all of my organizations. And like I say, I work in the home health field, but we very much partnered with our acute care partners throughout the state and have put together programs to handle COVID patients at home that can be discharged. Using a lot of telemonitoring such. So we've had so much exposure out there. Now the vaccine is available and we've had access to be able to get it. And it's been interesting to me that in some of our regions, okay, where nurses have actually been very reluctant to get it. We have like a 50% vaccine rate in some of our northern organizations. We're closer to probably 90% down in southeastern Wisconsin where I work. But I was looking at some of the literature and some of the social media aspect of things. And there are sites out there for nurses that just propel a lot of misinformation about COVID and the vaccine. And I've seen in response to that, now we have another nursing organization that's trying to really dispel all of that and really, you know, educate nurses. But I think like any population, you know, across the country, you have people out there that whether they are non-believers or it's based out of fear of adverse reactions, there's reluctance out there. It's surprising to me. I thought everybody would be signing up immediately, and that has not been the case.
Okay. Yeah, Phil, you want to fill us in then on what you're thinking?
This is the classic me versus we idea of, is it a personal freedom? Is it the control of my body? Or is this for the greater kind of good? If we loosely or think about empathy as understanding and sharing the feelings of others. If you're a Stephen Covey fan, it's seek first to understand others' points of view and then be understood yourself. So it's that walk a mile in my shoes. And this debate that's going on, it's very interesting in that it almost always closely follows the feelings that many people had around influenza and getting vaccinated around influenza. This is a very different disease. Many employers mandated influenza shot as a condition of either employment or as a condition of health insurance. And we got kind of used to that inside healthcare. But as long as this emergency use authorization is still on this vaccine, we're really not seeing people flock to it like we really thought they would. And so it's not like influenza. And the reason it's not only because it's more deadly and so on, is because now in the United States, we have our highest officials saying there is a number. And that number is herd immunity. It's somewhere between 70 and 80%. And so if we don't get to that number, unlike all the other kinds of inoculations and vaccines and so on that we've had, if we don't get to that number, all of us are not going to be able to participate like we would love. That means getting back to normal. And so this is really different. And right now, Lisa said, the numbers are running about 50%. And that makes this 70 to 80% number just seem very distant, very remote. And it really makes then those folks that want to get there sooner rather than later to this 70, 80%, it pits them against others that say, well, I'm not so sure. Let's let the numbers come in. Let's look at the long-term points of view. How do we really know a year or two or three? And what about these new strains that are coming in from South Africa and UK and so on? So the classic me versus we argument, and we've got a long, long way to go, but we have to pause and step back and listen to both sides and bring empathy into that discussion.
Hey, thanks, Phil.
Hi.
Now,
Can I just add?
Brian did a presentation earlier this week. Was the Holtz's Heroes about the COVID thing, Brian?
Yeah. So Lou Holtz, I didn't want to interrupt, but Lisa, I think you had something you were
Okay.
just about to say. I didn't want to interrupt you.
Okay.
No, I'll just wait till you're done, then
Okay.
just kind of add on a little bit. Yeah.
When I get the mic, I don't usually give it back. So no, yeah, Holtz's Heroes is just it's an organization through Lou Holtz. It used to be called Lou's Lads, and they have a bunch of things that we focus on, but we had a talk on Monday, and COVID was a big topic. There's a few docs that were on it. So it's certainly been a topic we've all been aware of for a while, but with my response to this right now, there's a couple of things. One, let me just be real direct. Everybody should get the vaccine, right? So I'm going to start right there. And I want everybody who hears this, if anybody hears this, they need to go get the vaccine. There's two things I'm going to piggyback off of what Phil said and Lisa said. It's just, number one is education. Most people just need to be properly educated on what's going on and what it is, what the vaccine is. And then two, it's the messenger. How it's being delivered is critical. You can't have something shoved down your throat, and it needs to be presented the right way. And that's the key. And that's what this, Phil was just saying, empathy is important. You have to show that you understand it and you're not forcing it on anybody, because we all kind of you back that dog into a corner, they're going to come out fighting. There's a way to deliver this message on the vaccine the right way. And once that's delivered the right way and they understand it's a messenger RNA and it's not invading the nucleus of the cell, we're not going to grow a third ear on the side of our head and all these side effects that people are worried about, when they understand what it really is, and that this is probably the new wave of vaccines when it comes down to it with mRNA. There's just stuff that we've learned. And I'll be honest with you, I had to learn a lot. And as a doctor, I should know better. But I had COVID back in November, and I luckily found it early with Notre Dame gets tested 4 days a week, and I was one of them. So I found it and I got sick. And afterward, I was like, I don't want to be sick again. So I didn't want to touch that vaccine when I first heard about it, but I had 90 days to think about it. So I was fortunate. Now that I've hit my 90 days, I signed up immediately because I've learned so much more about it. My response is we just have to deliver the message better. Everybody has to deliver it. Are we going to get to that 70, 80%, Phil? I don't know. I mean, I hope we do, so we can all get our life back. That's what our goal is. But I do think we have a better way of presenting this message and getting it out there. It's just knowledge. Get it out there the right way.
Yeah, Lisa, we're going to pick up your comment here.
Yeah, just to kind of tag on to that, I agree completely with what you said, and we all need to get vaccinated. But I think that, when you look at your healthcare workers of color, okay, particularly There's been, studies looking at these healthcare workers working in skilled nursing facilities, nursing homes, a lot of reluctance to get vaccines in that population. And a lot of senses, this big government, and fear. And I've also read recently, and I've heard this years ago, but among some people, there really is a belief that, with this shot in your arm, they're going to inject a microchip that they can track you. I don't know if you've read that recently. Mm-hmm. And I actually heard that probably about 10 years ago when we were doing flu vaccines, in the hospital, and the nurses who were administering those vaccines were telling me that there were staff coming in and that was a real concern to them. Hard for maybe us to believe, but I think, when we're looking at, these populations, we do have to be empathetic, and maybe, we're very fact-based, we follow the news, but there's so much emotion that goes into that, and, just fear, especially in some of those populations. I even just read yesterday, I think, that for the first time, our expected life expectancy has gone down, among all populations, but more so in the Hispanic and African American population. And they attribute some of that, to the pandemic. But I think we have to just really be empathetic and understand where they're coming from, and how we convey that information to really get past, some of those beliefs that some of us may be hard pressed to truly understand, but we need to.
At least about once
go on, Brian. Go on.
Once we all adapted cell phones, we basically put that chip in our arm. They follow us anywhere we are with our cell phones.
That's right. Yeah.
That is true. That is true.
Ken, sorry to interrupt. You've been vaccinated. Did you have? And people may know that we're a little bit more close than ideal, but Ken's been vaccinated, and we're wearing masks. Did you any trepidation? Or you just boldly went in there?
No, I had a terrible side effect from the first vaccination. I went home and I turned on the TV set. I was looking for Chicago White Sox highlights on television. So I called up Beacon Hospital and I said, "This side effect going to last very long?" He said, "Well, don't worry. The highlights won't last that long either." Okay. So Brian talked about marketing. Let's go to another topic where we got two camps again, and this comes to wearing masks. One group is pleased with the so-called mask mandate, and others feel that, again, the mask mandate is either meaningless or a personal freedom issue. So let's go to Phil and have him start off the panel's response to the mask mandate.
Yeah, it's interesting where you look to enforce these types of measures. St. Joseph County here in around South Bend has a mask mandate that many of us work for that has a fine backing it up. And to date, I don't think anybody's ever been fined, but people were looking at the health department to put some teeth into this so that they, as an employer, or had a store or restaurant owner or something like that, there was some teeth into it so that they could say, well, it's not my decision. This is what the county health department, or this is what our governors asked, or whatever that might be. There raises a tremendous number of ethical issues to ask our employer community to be the enforcers of all of the mask and eventually mandates for vaccines. And so I'm not sure the employer community is really equipped or wants necessarily this responsibility to enforce this. But like every store that you go into now, every restaurant, the menus are gone, the QR codes are all there, and we're doing everything to keep tables apart and one thing or not. And masks are always mandated of one kind or another. But the quality of the masks and the quality of wearing of the masks is very different, very suspect, and very uneven. And so I'm not sure we should always put our store owners and our employers to be the ones that have to enforce this mask mandate. We should all want to do this, as Brian said, together, because it's the right thing to do for our community and for our own collective health. But until there is a little more specificity in the education, I just can't imagine. We've gone 1 year now, 1 year, and still an uneven demand and supply of personal protective equipment and masks, these N95s. Some places are forcing their caregivers to use the same mask for an entire day. Other places, it's one mask per patient. And so there just doesn't seem to be a national standard for masking. We have some education around how best to wear a mask and one thing, but you think at this point in time, after a year, we'd have a lot more knowledge about what an effective mask is, how to get one, how to wear one, and make sure that it really does protect not only the individual, but the individual's transmission as well. So again, every health department in the country, every health department in the state is having to figure this out and do it on their own. It's really a patchwork.
Well, speaking of masks, Brian Ratigan used to wear a mask when he was playing for the Indianapolis Colts, not only on the field, but off the field, because in terms of uneven performance, the Colts got a lot better after Brian left the squad. Maybe it had something to do with a guy by the name of Peyton Manning, but let's turn it over to Brian. Let's talk a little bit about masks here, Brian.
Thank God you mentioned Peyton Manning. I don't have a good enough confidence level to think it otherwise. Yeah, coincidentally, that's my line. They got a lot better when I left. The mask there certainly didn't prevent any COVID transmission that we got to wear. Short answer on this one is you got to wear the mask. So the people who say don't, I have some close friends that still refuse to wear the mask. And I tell them as much as I can, tell them blue in the face, you have to wear the mask. We all have relatives, we all have friends, we all have people we know that we like that they just won't wear it. And they refuse to wear it, and they want to challenge all these local businesses. And I feel bad for the businesses because it's not their job. Like Phil was saying, it's not their responsibility to have to sit there and police everybody, but it's become that a little bit, it's been taxing all by itself. But short answer, you have to wear the mask. We got to do our best to wear it the right way. Double masking's now been shown to be a little bit better. You have to do it. Now we wear them a lot in the OR, but it's not the same. I do miss seeing faces, and I won't lie to you, I don't mind these Zoom calls. A little disappointed to see you and Brian with a mask on. I get why, but it's nice to see everyone else's face in here. It's refreshing somewhat to have a Zoom call to talk and they can see your face, because part of what we do when we meet patients is try to figure out, how to interact with them. And the face, you can only get so much from the eyes, right? And you got to make some reactions accordingly. So I'm looking forward to it. Someday we'll get rid of them.
Yeah, Lisa, you want to close up on this one, then we'll move to the next topic?
Yeah, we've had a mask mandate in the state of Wisconsin. The Republican legislature against the Democratic governor, tried to fight that and remove it, and then he reissued it. I mean, for the most part, within my organization, it's required. As far as our staff, they must wear masks. We have not dealt with the shortage of basic surgical masks, but we've certainly dealt with a shortage of the N95 respirators. And we've had to make some decisions in terms of when we're using those N95s to ensure that we have them in the highest risk of the situations. It's interesting in the southeastern Wisconsin, no one goes into a store without a mask. I mean, it is just accepted. In my area, I'm not seeing that, but I know in some of the more rural areas, there's still a lot of, fighting that. And I guess, when you talk about the personal freedom issue, I think personal freedom, is not just doing what you want to do. It comes with responsibilities. It comes with responsibilities for consideration of others. So that's a hard one when people are so stuck on, it's my decision to not do this. It doesn't matter to me, and you're not thinking about the other person. Is that what freedom is? So that's how I would close this out.
Yeah, it also introduces this concept of culture. There's certain little micro cultures all over.
Right.
And some of those cultures just, even if you want to wear a mask, it's sort of a badge of being weak and, some political notion or something. And so all these little microcultures can either help it, meaning I'm part of this team, I'm wearing my mask because I care about my teammates or my community or whatever it is. And then there are others that say, no, it's all about me. And we don't wear masks here because, and then, here are all the reasons for that. So culture, however you define that, really helps or hinders our ability to have a uniform approach. Education's one thing, but if culture is working against you, because the culture of this work group, we're real people here. We don't have to wear those sissy masks and that type of thing. Then no amount of education is going to change that. So we have to change not only, as Brian said, the message and the communication and all of that, but also we have to change the culture so that people are then more caring. They let other people that may differ from them express themselves by mask wearing or getting vaccinated or social distancing and whatever it might be. But boy, there's a lot of culture that's working against compliance right now across the country.
Now, speaking of education, let's go to Brian. You got something to add?
Yeah, do you mind saying one more thing on that with the mask? The next question is going to be, okay, I've been vaccinated. Do I have to wear a mask? Right? Yes. The answer is still yes, because the evidence is not there yet to show whether we're stopping any particle transmission by mouth or nose. So we still need to make sure that message goes hand in hand with the vaccine. When you get the vaccine, you still need to wear the mask. So before we leave the mask topic, I just wanted to say that. And Phil, when you say the word sissy, orthopedic guys hate that word. We get real defensive. We're a bunch of meatheads. We like to pretend we're not. So we absolutely are going to fight this mask thing.
Well, speaking of education, I wanted to turn to another topic, and that's the role of medical jargon and its impact on empathy. Now, I'm a tax guy, and you know what? I use jargon because essentially it puts me into my comfort zone. It tends to put medical professionals into their comfort zone, but in some cases it might create a barrier for the patient or a level of confidence for the client. They say, well, this person must really know what they're talking about because, they mentioned this, that, and the other thing. On the other hand, it may create a real barrier because somebody will say, I really don't know what this person's talking about right now. So let's talk about, is the use of medical jargon something that helps or hinders empathy in healthcare? And we'll turn it over to Brian. He'll be the kickoff person on this one.
So kind of, yeah, this is a great hybrid here. This is what I call the art of medicine, not the science. So that's what differentiates a lot of doctors in my book and nurses. I grew up in a household where my mom was a nurse for 50 years. So I learned a lot about what she thought of doctors and how they didn't always have great interpersonal skills. And it was all about listening, right? You get 2 ears, 1 mouth. So the art of medicine is everything when it comes to using medical jargon. You got to get a feel for your patients. They're all different. Some of them are very scientific and you just stick to the facts and that's what they want to hear. And some of them don't want to hear anything about it. There's a lot of studies showing that patients remember about 40% of what you told them in the office. Ken, I think you're sitting right about 20%, which is pretty good for you. You're an accounting guy. I stick to numbers with you. But so you can spend a lot of time, and I try to pride myself, and I know a lot of other guys do too, about educating the patients as much as possible so they leave without questions. But it happens. So you can only do so much, but you just really got to focus on having a relationship first. You sit down, you talk to them, you get to know everybody first, figure out what's going to work and do your best. And sometimes it works. I don't hit it off with everybody, but I certainly try and see if I can figure it out. But they are different. You have to have different tools in your toolbox ready to talk to patients and do your very best so that they know when they leave that they're at least getting what they deserve. And that's a fair treatment plan.
Well, I got to say, Brian really helped me because he told me that for my knee, we need to do something called a PRP. I thought what he was describing was the Notre Dame offense. we'll pass, we'll run, and then we'll punt, okay? But it really kind of a platelet-rich plasma, okay? And it helped my knee feel a lot better. Lisa, what about jargon? Does it help or hinder empathy in healthcare?
Oh, it absolutely hinders empathy. This is a really important topic, and certainly Brian really introduced it very well, but the majority of people do not understand, the healthcare literacy illiteracy is really quite high. Certainly among some of our higher risk, patients that we care for, but also among educated people as well. And we have to really be attentive to that. I had shared when we were, kind of talking about doing this presentation, this panel discussion, my husband, who did go to Notre Dame Law School, so he's a smart guy, okay? He underwent open heart surgery some months ago. He'd never had anything wrong with him, and now all of a sudden he's in the healthcare system. And he really faced that. I mean, he's a smart person, obviously, but we do tend to talk in higher level terms, and I think we even make assumptions for an educated person. So we have to be really aware of that. I teach a couple of classes routinely to all of the new nurses and therapists that are hired to our organization. And I do incorporate that in my teaching, because if we're looking at home health care, that is what we do. We are helping patients adjust to living with a chronic illness. We're teaching them complex procedures such as IV therapy at home. We have to be very aware of how we are conveying information and ensuring that the person understands what we're talking about. There is an evidence-based technique that's called teach back, meaning that you're not testing the patient, but you're asking the patient to repeat back some key information. You'll need to call me if this or this, and have them repeat back instead of just saying, so do you have any other questions? And then they say no, and you leave. We have to really ascertain their understanding. And one of the other things that I include in my presentations, the CDC and the Agency for Healthcare Policy and Research actually have like dictionaries of, high level jargon we use in healthcare with some similar words that are more simple, and they're called plain language. And I share that, with our clinicians so that they think about that as they speak to patients and their caregivers, and as they ascertain that the persons really understand.
Yeah, Phil, let me pose the question again.
Yeah.
Use of medical jargon, something that helps or hinders empathy in healthcare?
I'd say also we need to look at whether this exchange is a transaction versus a relationship. I'm willing to put up with a lot of jargon in a transaction. I know what I want. I had to get on an airplane recently, and I needed a negative COVID test 72 hours before. And, there were 6 different names for all these tests, and the antigen this and one thing or another. And I was willing to put up with all that because it was basically just a transaction. I wanted to get a test, I wanted to get a negative result, and I wanted to upload it to a portal, but if those lines get blurred between a transaction that we're after versus a relationship, and often that with either our primary care physicians or nurse practitioners or our specialists that we're talking to. If one of them thinks it's a transaction and the other thinks it's a relationship, boy, do we have a mismatch there. And as Brian said, that's the art of medicine that enables you to connect with patients. It's more about your heart than it is necessarily the head, because there'll be some concepts that just patients don't understand. And so the foundation then is trust. Do I trust what I'm hearing, and do I ask enough questions and that sort of thing? But boy, those lines are really blurring, particularly I would say in a number of younger age groups that just think medicine is all transactions. And many folks think, no, that's where jargon gets in the way. And there's so many nuances. There's so much chemistry between a patient and a caregiver that we really need to spend time and take it out of that transaction type of category. And so that's where we often run into these problems of these three-letter acronyms that we bat back and forth. And again, that really is confusing. And we have to say, well, how would I feel if I didn't understand that and I was asked to undergo a procedure or do something, and when I didn't have that kind of knowledge? And so if you've ever been a caregiver for a parent, many times the parents get back from a physician's office and the children ask, well, what did the physician say? Oh, she said everything was fine. And then you find out there was like a 25-minute discussion about something. And so, it can be generational. It can be all kinds cultural, one thing or another, whether asking questions and probing and looking puzzled is acceptable or culturally appropriate or not, and that sort of thing. So there's just lots and lots of cultural barriers also buried in this whole idea of understanding medicine in scientific terms and then giving consent. So very, very difficult topic.
Well, thank you. I wanted to give the people watching us on Zoom a chance to put together a chat or a question for us. I wanted to talk a little bit about jargon because, again, I fall into that area. For example, when I talk about something called AGI in taxes, that's adjusted gross income. But I tell my students that's not the way I interpret it, because my culture says that stands for another great Italian. I got picked up by the St. Joe police about a week ago. They pulled me over for a DWI. I said, listen, I don't drink. They said, no, but you're driving while Italian. So they had me again, okay? So let's see if we do have any questions. Brian, we got something that we can throw out there for us?
Let's we've got a couple questions here. At my company, we celebrate empathy and selflessness as key values. Hard to reconcile not taking the vaccine, waiting for herd immunity does not seem to be a selfless behavior. So maybe, in a sense, the participant is really agreeing with all of you. I think that as leaders in our organizations, we've got to have these core values, set the right tone at the top, and that this, these specific examples now of mask wearing and so on should be consistent with the values of the organization. Is that fair to say that Phil, just as a CEO, for example, of Beacon, you set the tone from the top. So imagine having all of your employees when you were in that role wear a mask would have been consistent with your core values.
And you just put your finger right on it when you talk about core values. The secret of core values is to very succinctly describe what's meant by those. Often we talk about values during orientation, new employee orientation. They come in and we talk about respect and integrity and compassion and caring and all that sort of thing. And that's the only time we ever talk about it. Mm-hmm. Well, the secret to values is, number one, being very specific about what we mean by that. If I were practicing this value of, say, integrity, what would I be doing? What would I be saying? What would you see me doing that would really inspire me to adopt and practice that value? Something as simple as respect. We think we all might know that, but respect means different things to different people. And so it could be respectful of my broader community, my coworkers. That's why I'm masking and getting vaccinated. But respect to others might mean, oh, wait a minute, respect is a two-way street. It means respecting my opinion that I don't want that vaccine, I don't want that mask, and respecting the fact that it's my body and all that sort of thing. And so you have to be very, very careful that you just don't put a value up on a wall and not talk about it the rest of the year. We need values are living. We need to have behaviors and expectations attached to them from the top, sort of all over the organization. And so just having a value isn't enough. Better be sure we understand what that really means. And all of those values, those 4 or 5 that almost every organization has to be redefined in a COVID environment, because things have changed so much in the last year that may have meant this 12, 14 months ago. It also means this today in this environment.
Let me follow up on that, because I worked for Johnson & Johnson for many years. When I walked in every day, we saw the credo on the wall, but that was more than just a sign on the wall. It came up at meetings on a regular basis. So we had a specific value. There was consistent communication about it. It was a real value. Anybody else want to fill in on that Q&A, either Brian or Lisa?
I can just add, I agree with you. The value has to be lived. Historically, we had these values: rights, respect, integrity, development, excellence, and stewardship. And they were lived within the organization. And when you had your annual evaluations, for example, the manager would send the form to two of your peers. So you had to be evaluated by your peers and how you lived out the values. So you could be this excellent clinician doing excellent work, but if you were perhaps disrespectful to people, that's going to reflect, in your evaluation, potentially in your pay. But to me, that was very effective, that we've really tried to live those values, not just have them, on a sign, and the expectations made very clear.
Brian, you want to add anything to that, or can we?
Yeah, I'd just say,
Go ahead.
in our
Go
group,
ahead.
we got to stay universal from top to bottom, right? Every employee. So docs, from the time they walk in the door to the time they leave, everybody has to kind of be the same. So if it's, the value, if we're talking about mask wearing, we all got to do it. If we talk about respect, whatever it is, it just has to stay top to bottom. However you want to look at it, across all planes, everybody in the organization has to be as consistent as possible. You can't have one doc walking around without a mask. It ruins it for everybody. You can't have one nurse. You can't have one secretary. We just got to see universal. The organization has to run that way.
I love the surveys I get from South Bend Orthopedic and other places, and they will start with the person you interact with first, which is not a doctor or a nurse. It's typically the person who's taking your information, and then it goes on, and we do a deeper dive in terms of, well, how did the nurse practitioner handle you well? What about the doctor, etc. Let's go to one more Q&A. I've got to say adios because I got a class I got to get to.
Kent, let me jump in and piggyback on that. The larger organizations get, the further away a lot of our staff and employees get from where the action is, from the frontline people. And organizations, if they want to build empathy in their culture, has to really, really work at this, because sometimes the people doing some work are so far remote from and so far removed from what goes on at the very front lines. The best example of that I thought really, really helped build empathy is Earl Bakken, the former co-founder of Medtronic. Every year he would bring all their employees in, and they would get to hear firsthand what those products that they made were doing in terms of saving people's lives and changing people's lives. And it was firsthand knowledge from the people that actually used it and benefited from it. And it was a very emotional kinds of presentations, but it connected the empathy from the caregiver, the patient, what they were all about as a company, clear back to some remote worker that maybe just put some wires together. And that was, you need to do that, because as the organizations get large, you get very remote from where the action really is in terms of empathy building and empathy development.
In many ways, the TV show Undercover Boss brings that out, where the person will go out and they're the CEO or whatever, and they're talking to people where the rubber meets the road and getting a different look at the organization. Now, I've got to hit the road. Thank you very much. Brian and Brett are going to close us out. I'll look for you later.
All right. Well, thank you, Ken. As always, we're going to let Ken go off it. Like I say, he wears many hats. He does it all here at Mendoza. So now with Ken leaving us, I'm going to take this off. And we got a number of questions here. How should enforcement of mask wearing work if not through enforcement by businesses? And I think maybe there's at least a few flavors of this question. One is, we've already sort of addressed maybe the employee population, that it's the tone set from the top. It's consistent with these core values that have been woven in the culture, but maybe it's a little tougher with businesses and their patrons, their customers. And any thoughts about that? If you're a business person, how do you I don't know what. Yeah, everybody's got signs now that say something like "No mask, no service." But how do you have to hire a security guard? Do you persuade people? Do you look the other way? What do you do as a business person nowadays if somebody's not wearing a mask?
Well, on our end, we don't force anybody. Like we don't prefer to have police involved.
Sure.
The only time you get police involved is if it gets hostile and gets a little bit angry and it becomes a scene. You just try to talk to people and be honest. And most people to their core understand if you approach them the right way. I said way back at the beginning, you just can't come fighting at them. You just got to come at them reasonable. And we try to do that the best we can. When they come into our lobby, we have the social distancing. We keep people in their cars now. We don't call them in to our office until we're ready for them, so we can keep some space. But you inevitably still have a couple of people coming in at the same time. And if one of them doesn't have a mask, we ask them. There's signs everywhere, and you ask them, and some people just refuse. And they don't get past the front door. And we just have to ask them to come back, or go to a different establishment. If they don't want to do this, it's just in the protection of our employees. Again, you just keep reinforcing the same theme, and you do the best you can. Some people just will not change their mind.
Yeah, no, and I think you have the benefit. So one, that's a great example for everybody too, that you hold that line, especially as medical professionals. I think you also, given who you are, you speak with authority on the topic that this is obviously important. Okay, how about another one here? We got, do you think that empathy has been enhanced or hindered amidst the pandemic? Any thoughts from our panelists on that? And I hear, here we are on Zoom, and it's hard. We had a little bit of a pre-call, and Phil teaches for us here at Mendoza, and I know all of you speak. And on the one hand, Zoom has opened things up, and on the other hand, we're now living in this virtual world where we're each in our own private space.
But before, when we had influenza vaccines, start with that, all the hospitals in the region and the state got together and they kind of agreed that, a condition of employment or a condition of getting health insurance was to require influenza vaccines. And so if you wanted to work in healthcare, and if you wanted to work at the front lines, you needed to get a vaccine. And so we didn't have a chance to go through all of the education necessarily. We weren't forced to try to do that because we relied on a mandate and a regulation, or a business practice, as it was called at the time. Now, during COVID, when we have this emergency use authorization in place, we are forced to not use that. And now we have to use simple persuasion, and we have to develop the culture that we want. We have to value and be respectful and work on empathy. So it's taken it sort of an easy route away with a mandate, and substituted a lot of communication, a lot of education, a lot of empathy development. And that's forced us to really focus on the message, the content, and trying to be persuasive as leaders, as opposed to just relying on a mandate that once it's in place, you don't have to have this discussion anymore.
Right. So it's incumbent on our leaders, but then really incumbent upon all of us. I guess it's the old phrase. It takes a village to all of us to be empathetic, but also persuasive. All right. Here's another question. My grandparents are wary of getting the vaccine and have many strong opinions against it. What's the best way to show empathy while also encouraging them to receive the vaccine and protect themselves. And we had a panel yesterday, and I was sort of the poster boy for what not to do in that particular situation. I would have said, I'm from the government and I'm here to help, and here's what you need to do. And that's not very empathetic. So that we have some empathetic people on our panel, in addition to being trained medical professionals. So any advice for our participant here about how to persuade their grandparents and be empathetic at the same time?
I think you need to identify what their biggest concern is first. So that's the key. Everybody has their own concern, whether it's taking away their personal freedom or whether they're afraid they're going to change the mutations and have that third ear, right? You got to find out what their concern is the most, and then educate them on that. So if it's some sort of misunderstanding about what the vaccine is, like many people think it's a live virus and they don't want to get it and they don't want to die. So, basically it's kind of like you get the virus, you could die. You get the vaccine, you might get a little sick for a day or two, but it's just because you're upregulating your antibodies. You're learning how to fight a disease. You're not getting the disease, and you're preventing the severity of the disease. So, some people are pretty brutal in how they talk about it. Like, you either get the vaccine or you get intubated. There's that's a harsh way of saying it. So you got to kind of get a feel for how you want to go about it. I wouldn't talk to my grandparents that way. That's very disrespectful in my mind. Some people would, and some people have to hear it that way. So my recommendation to them would be, first find out what their biggest fear is. What's the reason for not getting it? And then answer that question. Don't tell them what you believe. Find out what they need to hear.
Okay. So Lisa, I see you have your hand up. Something to add on that one?
Well, I wanted to add on the previous topic about, have we been more empathetic in the context of the pandemic? And to a lot of degree, I think that it really has made us much more sensitive to the fears that people have. I'm thinking back to the early days, working in home care, and the fears that the patients would have, having a healthcare provider come into their home. They need the care, but they're afraid, or else they're welcoming that because they don't want to have to go out to some types of clinic or such as well. So I think that we have been trying to really support and help our patients understand, that we're using all of the appropriate personal protective equipment to protect them when they're in the home. And then there was another question in the chat room about the use of telehealth and telemonitoring. And that's something that we started to use more widely. We've always had that available, but that's actually been comforting for patients as well, that we can put the telemonitoring or the telehealth equipment in their home. We can still connect with them, perform basic assessments, and that, is being empathetic as well. And I know some of my colleagues, primary care docs, have done a lot more telehealth types of visits, again, with some of these at-risk patients. And that has been really meeting a lot of needs out there, more so than some of these physicians ever thought it would do. They feel like their relationship building in that kind of context has actually been very empathetic and helpful. So I think that we've been very sensitive as healthcare providers and very empathetic to fears and concerns.
Good to hear. Other thoughts on that one? Or?
Yeah, Brian, there may be, beyond what Brian said about finding out deeply where their fears are, here's a suggested hierarchy. First, always start with their personal family. They are more concerned about personal family, and grandma, if you don't get the vaccine, you may not get to see your grandson graduate, or something. Make it very personal, and families first. Second is their friends. They may not be able to return and see their buddies at the club, or they may not be able to play bridge or whatever that might be with their friends. That's second. And then third, their own community, the way they define it. And that's so important, that you won't be part of that anymore if you get this horrible disease. And so family first, friends second, immediate community third seems to be a way to be more persuasive and more influential to try to get people to move off of their position.
Well, so good, again, good advice. It is humbling to listen to all of you, and obviously we're grateful. Let me sort of piggyback on this and go back sort of one of Ken's early questions and give you a question I threw out in our pre-call. We're going to use an article coming up here in class. There was a suggestion a while back that we should get NBA players to get the vaccine early. And some said, why would we give young, healthy millionaires the vaccine early? And there would be this symbolism to certain communities that, you know, if LeBron James if it's good for LeBron James, it's good for you. And so maybe let's ask our three panelists here, put on your healthcare czar. Are there any folks or any communities, maybe symbolically, that you would try to persuade to get the vaccine in a very public way, to try to persuade members of those communities, whether it's our participants' grandparents or anyone else, or maybe would there be certain communities that you would emphasize first? We have sort of a hierarchy of who's been getting it. So either symbolically, would you try to get some segment of the population to get it first, a celebrity, politician, whoever it is, or maybe rejigger who gets the allocation first?
I think I'd be careful with picking out a group of people like the NBA players to vaccinate first, to try to build momentum and motivation for those people to be excited about getting it. The CDC has come out with their recommendations for a reason. They have the classes, the 1A, the 1B, the 1C, and the 2s, and I think we should follow those. I do believe that we do that for a reason medically. So in that stance, I think we stick to what we have. What you can do instead of giving the NBA players or vaccine is if you can get them on board and get them educated, have them promote it, have them say, go get the vaccine, have them be the ones to send the message. This kind of goes back to the very first thing I was saying, is the messenger is probably the most important thing we have here to deliver. What's important is the education, right? So we can talk all day about why to get the vaccine, and we briefly touched on it, and about the variants as to why you still get vaccinated. And social media is devastating to figure out these answers. You can't go with what you're seeing on TV. It's not good. You have to go with evidence-based medicine, which is, I think, what Lisa said from the very beginning. So I would say we stick with the order, the hierarchy that we have while we still have a shortage on vaccine, until everybody has access to it. And then we can load them up and then go with all the movie stars and athletes you want. But right now, I think we got to stick with an order.
Or maybe, kind of, you alluded to maybe a public service campaign where they maybe they don't get, maybe it doesn't show them getting the shot, but it shows them advocating that they're, I'm going to get my shot when when it's my turn. I hope you will too. Something like that. I'm sure there's a catchier way to say that. Other thoughts on that, Lisa or Phil, if we mind that one?
I agree completely with Brian on that.
Okay.
Yeah, we're starting a vaccine campaign in St. Joseph County here, and we're using people that have been vaccinated that are either recognized formally or informally as being real leaders in their community, particularly communities of color. And so there are plenty of those that are willing to stand up and come in and show being vaccinated and have their picture taken and all of that sort of thing. So I don't think we should necessarily rely on the MBA and entertainers. Stick with the hierarchy, stay with it, and there's plenty of superstars and well-recognized leaders in categories that are already vaccinated.
Well, we're going to have to, I think that's really a wonderful place to end. Our thanks to our panelists here. What an education. I know you're all very busy. So what an education for the rest of us. Thank you in this lesson in empathy and healthcare. Thanks to all the participants, and to Ken Milani, and to Brett Beasley, our Ethics Week MVP. So it's a wrap, folks. Thanks so much. Go Irish.
Go Irish.
Thanks.
Thanks, Brian.
Thanks.